This is Dubai Eye 103.8.
The region's favourite doctors, live and listening.
Doctor, give me the news.
On Afternoons with Helen Farmer.
So it is time for your appointment. Now, we have him here until 5 o'clock, so get in touch. It is Dr. Rajeev Lochan, who is an interventional cardiologist at Al Zahra Hospital. Thank you for coming on the show, first of all.
Thank you.
So, I think it's worth pointing out heart conditions, heart issues are prevalent here in this region in particular. People in the UAE die of heart attacks almost 20 years earlier than the rest of the world. The threshold for cardiac arrest and cardiovascular disease worldwide is 65. But here in the UAE, people are suffering from CVD at the age of 45. It is worrying. And as always, I'm sure most doctors will agree prevention is better than the cure. So, Dr. Rajeev, you are the head of the cardiology division at the hospital. Why is it happening here?
Well, that's an interesting question because there are so many changes in the people who are living here. We have much younger workforce who work in UAE on the whole, and they come across and they have excessive stress at work, at long duty hours, at travel, time to the work and going back. So there are many factors which promotes. At the same time, UAE offers you very nice variety of food, and you eat and enjoy food. When you come from another country, you keep on enjoying this food, and that also is not so good for your health. Lack of exercise, of course. Smoking is very prevalent, and these are the things which promotes this disease much earlier than rest of the world.
And in your opinion, Dr. Rajeev, would you say that it is lifestyle choices that we need to focus on here?
That's correct. See, as we look at the statistics, the commonest risk factor is the genetic link, which we can't change, of course. Other things we can, like the lifestyle, healthy lifestyle like eating and sensible eating, more in terms of the exercise. Try to make sure that you don't gain too much weight here. All these things helps, and abstain from smoking. Smoking is one common risk factor which I have experienced in my practice, is the commonest cause in younger generation when they get heart attack. So we have possibility you can stop that.
Okay, so when a patient comes to see you in your office, is it too late? By the time they need to get an appointment with you, are they acting too late?
There are two ways the patient with the heart disease come to the hospital. One is the symptoms when their routine activity which involve physical strain, like jogging, for example, or some physical labor who is working on the field or on the building construction, and he starts having limitation in the shortness of breath, tightness in chest when he does, and that's the commonest way they present as like a stable angina or unstable angina. Another set of patients, they end up in emergency with acute chest pain or sometimes sweating and abdominal pain and some difficulty breathing, and some of them they faint, and they all come to emergency, and that's the acute care which you need a maximum treatment at the speed like in a fire brigade. So we have to work very fast to make them better.
Okay, so you've discussed the fact that lifestyle can be a major factor. Smoking is a real issue too. Are there other big factors, maybe having diabetes, being under too much stress, a lack of sleep, what we're eating, you've said is important, but can there be other, additional factors like the diabetes and people not sleeping particularly well?
It's good and interesting that you asked it. In Europe, in UAE or in the surrounding area, Gulf region, there was Gulf Race Registry was conducted, and later on Gulf Race 2 Registry was conducted. They came out very interesting facts that the commonest risk factor which we have in Middle East is the obesity, and which is again related to your food and lifestyle. Then is the high blood pressure and smoking, diabetes. These were much more prevalent in this population here as compared to Europe or in America. So these are the factors, in addition to work stress, are important in this region.
And do you think education is something that we need to tackle? Do you think we don't know enough about it, or not enough people know what they should and shouldn't be doing?
I'm very thankful to ARN for taking this step to call the specialists in the special areas. And at least this gives an opening to the people. They know very basic facts, but it needs a reminder. We know everybody knows from internet, but reminder is important, and that's how we come to know, and by listening to other people's ideas about the disease process and prevention. Prevention, as he says, most important. If we can prevent a heart attack, it's much better than having one and then taking care of that. So it's very, very important to prevent it before it attacks us. So that's very, very important aspect.
Okay, we've had an anonymous message come in for you, Doctor, and it says this: please don't ignore high blood pressure, as I ended up having a heart murmur from this. I now regret it. I take medication, but sometimes I feel faint. Do you know any reasons why this might be, and what I can maybe do?
Well, fainting could be various reasons could be responsible for fainting. High blood pressure itself could be, or it is related to heart an episode. But the way you understand and the question has been asked, it looks like it's more than one episode. So I don't think it can be heart attack. So there could be other reasons for the fainting. So I think that needs further investigation before going on talking on this.
Okay, we have another message that's come in for you, Doctor, as well. It says, what combination is good for the heart? Is it a combination of walking and going to the gym? Is it a bit of both? Is it one over the other? So this person's maybe thinking about making changes in their lives, but isn't sure of the best route.
Most important is what suits your temperament. Any type of physical activity, either exercise on a bicycle, treadmill, walking, swimming, whatever you think, or yoga, they all are good in their own way. We need exercise for the purpose of reducing weight and also increasing the capacity of heart to tolerate this strain. And this is a combination of cardio exercises and other forms of flexi exercises where you can flex the muscles. And both are important. And sometimes if you impose one, patient or my patients or the friends whom I advise them, they follow it for some time and they leave it. So it's more important what you like, which is physical active. You try to do that and specialize where you can do 20 to 30 minutes minimum exercise. Nowadays there is an interesting trend. It's an intensive exercise. If you do 10 to 15 minutes or 12 minutes intensive exercise 4 to 5 times a week, it's good enough. But if you are short of time, otherwise it's preferable walking like 30 minutes is good enough.
And I guess you're saying consistency is the key. Whether you walk, run, go to the gym, it's important to find something and stick with it.
Absolutely. It's very important. You have to maintain that regularly. If you try to maintain everyday exercise, you will end up with 5 days in a week. When you plan for 5 days in a week, you will never do more than 2 to 3 times in a week. So keep your aim high. At least you can have a moderate effect of this exercise. And it improves the cardiac circulation. It improves the extra vessels, which avoids heart attack damage, and that's we call collaterals. This is very, very important, and this is the reason many times you see the people from the army background, they don't have much damage on the heart in spite of their arteries are blocked, because they do exercise very well and it helps them.
Safe has texted in and says, what level of BP should be a concern to go and see a doctor?
Normal heart level, we call it about 130 and 80, although earlier we were taking the limits to be 140 and 90, but there has been little confusion between American and European guideline. But for all practical purposes, anything up to 140 is acceptable. But if it goes definitely above that, which means more than 20 about it, 150, 160, you definitely need a consultation, and it should be. If it is recurrent, if it is just one episode, it could be a transient. You just monitor it. And if it is recurrent, it is high, then you need to go to see a doctor and they will do some tests to plan the treatment if it is needed, or lifestyle modification. Most important nowadays, our approach is to change the lifestyle first and then apply that. If that doesn't work, then you go to the next stage or you do some test before going medicine.
Okay, we've had another question that's come in from Anonymous, and it says, I've been having continuous heart palpitations where I feel it pounding throughout the day and when going to bed. Do you have any advice for this person other than go and see a specialist?
This is usually happens for various reasons. One is that, for example, if your hemoglobin is low, your heart can be pounding. So you need to know that there's no blood loss or you're not anemic for any reason. And that can be the common cause to avoid the palpitation. Next is that if your lack of involved in physical activity, so your heart rate jumps very quickly. So start walking regularly, do some light exercise, and gradually train your heart. If it doesn't work, then you need further investigation to find out. And there are some medications which I can't tell you on radio that what you can take it, but that will be advised by the specialist.
Okay. Earlier in the week, we spoke to Briar Prestige, who's an entrepreneur and was chosen to compete in a reality TV show called The Social Movement. She and her team were assigned to help out a non-profit called Heartfelt. And we had her on the show last week, Doctor, talking about it. I would love to get your thoughts on this. I'll just play a little bit, so have a listen, and then we'll come back to you on it.
Now, I feel really passionate about this now because when I left, I had no clue that sudden cardiac arrest is the number one killer in the world, which is crazy.
I didn't know that either.
It's the media don't report on it, but it is. And the worst thing is as well is that people sometimes think that it's, people who get sudden cardiac arrest have to be fat or maybe unhealthy or, smokers, whatever. But that's not true at all. You see athletes just dropping dead on the field. You see people working in the very fit people going off into the military dropping dead. There was One Direction's sister who recently just dropped dead recently. Like it's horrifying, and it affects children and adults and people of all ages. So we were going out on the street and we were asking people, what do you think the number one killer is? And everyone was saying it's cancer or whatever, but no, it's sudden cardiac arrest.
So what do you make of that? Sudden cardiac death is something that we are seeing and hearing in the news, but obviously, Briar, that's a subject close to her heart. What's your experience of sudden cardiac?
Look, sudden cardiac arrest is not the same as the heart attack or acute heart failure because of the heart attack. These are the two different things. But people can die for various things. And the reason for them, young people dying early all of a sudden, or a sports person are dying early, there are some other reasons which they have born with some problems, which they don't know accidentally, and they are detected during this episode. There is some condition like they suddenly have some kind of cardiomyopathy where the heart rate goes 300. So the heart cannot tolerate and it goes in the heart failure. Actually, it's not arrested, but physically or physiologically it is arrested. It's not effectively pumping and people die. Interestingly, you asked this question, and I was involved with the checkup of the players, football players, because it's interesting that clubs and all these organizations, and especially in UAE, are very conscious about it. And we have to do a checkup of all the players before the entry level. They go into the big games and they have to be checked thoroughly with the heart. They have some markers. For example, there are some ECG changes which you can detect and they can find out, and you can exclude these people or these candidates from this competitive sports.
And this is a very simple screening process.
It's a simple screening process and cardiac examination with the stethoscope. We find if there is any heart murmur which could be responsible, or ECG changes and echocardiogram. So there are some simple tests which can be done, and it has been implemented last 5 to 10 years in Europe, and that's why it's becoming more popular everywhere, and a lot of lives have been saved with this.
Okay. Brian's got in touch on 4001 as well and says, what is the maximum heart rate an individual can have when exercising?
It varies from the age.
Okay.
According to the age, the heart rate is variable, and it's on the average, if the person of, say, about 40 years of age, I wouldn't expect his heart rate to go more than 190 or 200. So if it is more than 180 or so, he should be careful why it is so, and he needs to be seen. Otherwise, he have to gradually train his heart rate. If they're gradually increasing the load of exercise or duration of exercise and allow heart rate not to go suddenly at 160 plus, then it will be gradually your heart will be trained, and the same or higher workload, it will not reach to that level.
Okay, and can I ask you just, off the back of that question from Brian, what do you make in terms of a doctor that looks after heart? What do you make of some of the smart watches and the likes that people find that they use to monitor things like their heart rate and their steps? Is that for you something that's good? Because at least people can see, where they're at, and you have data as a doctor to take a look at?
It's very important. Actually, the smart watches are very helpful. They are giving the heart rate, and if it is heart rate is irregular, it can be detected. And these devices, various devices are available, and they can help the people to come and consult. I have few patients came after following their abnormal signals on the smart devices, and they came with the irregular pulse rate or pulse rate of 160 per minute and with some palpitations, so which we could correlate what was happening. In fact, the newer generation of the Apple Watch, you can record the ECG. Unfortunately, that's not released in UAE yet, but this is open in US market or European market. And in last American College, where I was attending the conference, there was a big session on the people. They were studying to collect the data from the irregular heart rate, which is a big problem in an aging population where the people end up with a stroke. So it's very important these devices have some good features, but we cannot totally be dependent on them. Some of the findings are not accurate, but of course, you need to go and consult and find out if there is something is happening wrong.
Yusuf says, hi, I have a question for the doctor. I have heart palpitations when I have a coffee. It happens most of the time, but I only take a cup every 2 to 3 days. Do you have any advice?
Well, it's very simple. If you have a palpitation with anything which your system does not agree, so you have to cut it down or change to type of coffee, maybe take decaf or some milder form, or not to take coffee. So that's the best thing. So it's anything which promotes a palpitation, you have to stop modifying your diet and change the diet.
So it's not what I thought, whereby maybe Yusuf is just caffeine sensitive, and maybe if he's just had small cups regularly, it might go away.
Mostly it is the caffeine which is the responsible for it.
Okay, so Yusuf, avoid the coffee, would you say?
Yes,
okay.
Avoid the coffee.
Okay, Yusuf, no more coffee for you. That's definitely the case. Okay, lots more questions coming in for you. Ellie, who's almost 40, says, I've been taking multivitamins since I was a teenager. Does that lessen or have any effect on the chances of having a cardiac arrest?
As such, multivitamins, they don't do much damage, but some of the multivitamins and their contents has to be seen. Like some of the multivitamins have blood thinners, which are in a very small quantity, but if you take multiple or many pills, that can be dangerous. And that's how many times it is advised that you should take them intermittently, not regularly and not in excessive dose. So usually they are not harmful, but when it is taken in the normal dose.
Okay, we have lots more questions to get through. I'll try and get through as many as we can as possible. This message comes in from Jinri, and it says, I have oatmeal every day, which is apparently great for the heart, but my auntie keeps saying it's bad for you. Is she right or am I right?
Sorry, I didn't get the question. Only once time a day this person eats.
No. This person says, I have oatmeal.
Oatmeal, yeah.
Every day, and I think it's great for the heart, but my auntie keeps telling me it's bad for the heart. Is she making sense or am I right?
Oatmeal is good because anything which has got a more fiber and is good for your digestion, and it's good for the heart because it has got a less caloric value. So that's okay. This is good for as such for the heart. There's nothing against as such which I know is related to oatmeal. So it's fine. It's good to take it.
Okay, we have another question that's come in via the Dubai Eye messaging app. Lainey says, does the temperature of the water we drink have an effect on our health? Because that's actually quite a good question, Lainey, because so many people think about that. You know, you get offered room temperature water or cold water. So does the temperature of the water affect us?
Well, as such, if you think of it, anything which is extremely cold, like a cold weather, is not good for the heart in a person who is already have a heart disease. In a normal person, it should not make a difference. It's the people, those who have a narrowing already in the artery, and they can have any kind of the spasm is induced by the cold also, and that can cause the angina. For example, it's very common, especially in cold countries where there are snow and they go outside during with the blocks in arteries, they have more symptoms and there are more heart attacks has been precipitated. Otherwise, it doesn't make a difference.
Okay, Mahinder's messaged in and says, how important is a lower level of BP? What should one do if lower BP is above 95 continuously? So Mahinder says that. Doctor, if you just explain, first of all, because that's quite a complex question. If we just break that down into two parts. So your lower BP, you often get a heart rate reading of something over something.
Well, as such, in medicine, we don't call any low blood pressure as a disease. It's not a disease, it's a condition. Some people have it chronically, and I would say they are better off as compared to having high BP. As long as you are not symptomatic with a blood pressure of 90-95, you are fine. Like most of the females, we get the blood pressure around 95, 98, 100, 110, and they're okay if they don't have any symptoms because body gets adjusted. So there is nothing like hypotension on that one. But if blood pressure is from 90 to become 75, which is a systolic blood pressure, drop from their normal level, then they will have symptoms like dizziness, weakness, fainting. Then you need probably some fluid, salt, supplement, and that helps to increase the blood pressure. So this is the symptomatic, like dehydration can precipitate this thing that you need it to take care.
Okay, we have an anonymous message that's come in on 4001, and it's this. What is the first aid for heart attack and what's the emergency treatment?
Well, in heart attack, usually something is that first you have to recognize it as a heart attack. But like a pain in the chest is the commonest symptom. But sometimes we have pain in epigastrium, upper part of the abdomen, which people think it's a gas or flatulence or something else, and they don't take any treatment. Even that pain which you think of gas, you better take a treatment. First aid treatment is if you think it is a heart attack, first is take aspirin, which normal aspirin can be taken at home, which is 300 milligram or 4 tablets of baby aspirin are very good to take to start with. And then you still have some discomfort, you need to report to the hospital as soon as possible. Don't waste time in taking some other medication or home remedies. If anything which is related to chest or abdomen, you must go to the hospital, and that should be well-equipped hospital. Nowadays, there is a heart attack center are available in some hospitals, and this is especially look after the patient with a heart attack. And the treatment nowadays for heart attack is the primary angioplasty. Earlier we used the clot busters. Now we open the artery immediately, day and night, 24/7. And earlier you can open the artery less than 90 minutes. Best you can do the patient. But it can only be achieved with the education of the mass population. They understand we have to reach in time, and the team. For example, we have made a separate section in Al Zahra Hospital Heart Attack Center. Probably it's one of the pioneering action which we have taken in this region. And we are able to deal with less than 90 minutes. On the average, these patients' arteries are opened and they can be improved, their function, heart is revived, and that is very long-term advantages in terms of the longevity of the patients.
Okay, Liam's messaged in too and says, what kind of heart ailments are most hereditary?
Well, hereditary, like hole in the heart, for example, cardiomyopathies, which is a thickening of the heart muscle. These are the conditions which come from by birth, and they are usually diagnosed early. Some, for example, cardiomyopathy, many times it's not diagnosed till adulthood or later on, or with some symptoms later on. So that's the condition which is missed many times. And these are the people, those who suddenly die and during the physical strain, and because they were not diagnosed before. So these are the common conditions which are heart related. And the holes in the heart, they are diagnosed early and they can be fixed. And interestingly, most of the whole of the heart now, they can also be fixed without operation. Earlier everything was treated by the surgery. Now we put some kind of umbrella or in between the two chambers of the heart, and that fix the hole without opening. So which is a great achievement.
Okay, final question, I think is all we've got time for now. This is from Joe. Joe says, what are your thoughts on the keto diet? It's extremely high in fat, but many swear by it.
Keto diet technically is high in fat, also and high in protein. Protein helps to reduce your level of cholesterol, but at the same time, the fat content increases the cholesterol levels. Many of the patients which come on keto diet, they reduce weight in a very short time, which is good. But main problem is that low weight or the reduction in weight, reduced weight cannot be maintained if you don't maintain the other lifestyle changes even after when you go back to the normal diet. So that's important. You can use a keto diet as long as you use for a short time and you come back to the normal diet and other lifestyle modification to maintain that life or continuing to effort to reduce the weight. That helps. Otherwise, it can be detrimental many times. It increases the cholesterol much higher level, which can be dangerous.
Okay, we had lots and lots of questions coming in for Dr. Rajeev. Apologies to anyone who we didn't get to answer, but I'm sure we'll have Dr. Rajeev back on at some point. Big thanks to our guest today, Dr. Rajeev Lochan, who is the interventional cardiologist at Al Zahra Hospital. Thanks for joining us on the programme.
Thank you. Thank you very much.
This is Dubai Eye 103.8.